Okay, I'm gonna be palpating your knee right now. So here's your patella here. Here's your superior pull, and then your inferior pull, medial border, and lateral border. Here is your medial joint line, lateral joint line. Your tibial tuberosity is under here. Distal quad, distal hamstring, lift your leg up. Distal hamstring tendons, lateral femoral condyle, medial femoral condyle, lateral femoral epicondyle, medial femoral epicondyle. Head of fibula is here, and then your LCL is going to be right in between, right there. Your MCL is going to be same thing other side around right here, MCL. And then ACL is going to be here, can't really be palpated, but it's in there. And then your same thing with your PCL, it's behind here. And then your IT bands here. And then your sartorius is going to come from here, and it's going to go all the way up. Special tests for your knee. So I'm going to start with the sweep test. So I'm going to go ahead and apply compression. Check for any swelling. Okay, and now I'm going to move into the palatable test. So I'm just going to apply more compression and push right here just to check for any more swelling. Okay, seems good. Okay, we're now going to do the bounce home test. So go ahead and lift your leg for me and let it be loose. And I'm just going to see. Okay, looks good. No severe joint fusion. Now we're going to go into girth measurement. So I'm going to start at the joint line. Go 3, 6, 9, and then do the same thing going upwards now. 3, 6, 9, and check for any swelling, or if one limb is smaller than collateral limbs here, and it looks good. Okay, no signs of atrophy. And now we're going to do the valgus stress test. So I'm going to go ahead and grab here and here, and we're just going to outward. That's at 0 degrees, and now we're going to go up at 30 degrees. Now we're going to do the same thing for the varus stress test, except I'm going to grab here and here, 0 degrees, and then same thing at 30 degrees. Looks good. Now we're going to do posterior drawer test. So I'm going to go ahead and lift your leg up, okay? I'm going to sit on your leg. I'm going to sit right here, okay? And I'm just going to push. Okay, seems good. PCL seems good. Now I'm gonna do posterior Blackmans. So I'm gonna put my knee under yours and go ahead and rest your leg. Perfect. And then I'm just gonna push in. Okay, your PCL looks good. Now we're gonna do the Goffrey's 90-90. Go ahead and lift both of your legs like this for me. I'm going to hold them and just observe them. Swipe them for me. Okay. Let's see. Okay. They look good. And then I'm going to do a posterior sag. So go ahead and lift this leg up for me and dig it into the ground, pushing it like, yeah. Or no, scoot it back a little bit. Okay, now dig it into the ground and then contract your leg. Let's see. Alright, that looks good. Okay. I'm gonna do the Lilly's test now. So I'm gonna place my hand under your calf and push on your quads. Okay, no sign of ACL rupture. Now I'm gonna do anterior drawer test. So I'm gonna sit on your foot here. Pull anteriorly. Okay. Now I'm going to do interior Lockmans. So, just grab your thigh here, right below, and just, okay. Thessalys test, I'm going to go ahead and have you stand up. For the Thessalys test, I'm going to have you hold my hands, and then go ahead and Lift the injured leg and squat down. Okay, looks good. Sit back down. Now I'm gonna do the Steinman's tenderness test. So I'm going to grab here. And just externally rotating. Okay. There was no catching or popping, which is good. Now we're gonna do the McMurray's test. So I'm gonna go ahead and palpate your medial joint line. Grab your heel, upwards force, and down. Again, out and down. And now I'm going to do the same thing, but your lateral joint line, bring it, bring it in. Okay. Now I'm gonna do the. Due to certain circumstances, we are now outside continuing the test. So we're continuing with the Apley compression test. So we're gonna go ahead and your leg up. I'm gonna put pressure on your heel, and then I'm just gonna rotate it. Any clicking or catching? No, so there's no meniscus injury. And now I'm gonna have you flip over, and then I'm gonna do the pinch test to you. So I'm gonna place my thumbs in your joint line and just, okay. I'm just gonna place my thumbs here on your joint line and just, okay. Now I'm gonna do, now you're gonna do the duck walk. So go ahead and stand up for me. And then just crouch down and tell me if you feel any pain. No? Okay, now walk towards me. Okay. Next, I'm going to do the patella tendon length test. So I'm going to measure the distance between your superior and your inferior poles, as well as your inferior pole and your tibial tuberosity. So here, and then we're looking for if there's a, okay, yeah, that's fine. Okay. And then patellar apprehension. I'm gonna go ahead and place both thumbs to your medial side and just push it outward. Okay, and now we're gonna do the patellar grind. I'm gonna extend your foot fully, okay, and then I'm just gonna push right here and go ahead and contract your knee. Okay, good. And now I'm gonna do the Renee's test. So go ahead and stand up for me. Okay, I'm gonna put my thumb on your lateral epicondyle. Here, it's up here, but and then go ahead and go down for me a little bit. Here, how does that feel? No, not like that. Okay, yeah, that's good. Okay, and then we're gonna do the Nobles test last. So you're just gonna sit here, extend your foot. I'm gonna do the same thing. And then we're gonna flex your knee doing that, right? And then extend, we're gonna extend it too, right? Okay. So you're clear of IT band syndrome.